% of coronavirus deaths in Africa are among patients with diabetes. Tonight in studio, I'm joined by Reuben Magoko. He's on this end. He's the chairman, Kenya Defeat Diabetes Association, and he is a type 2 diabetic. And also with us is Newton Muthaba. He is on this end. He is also with the Kenya Defeat Diabetes Association, and he is a type 1 diabetic. Thank you very much for joining us, gentlemen. I'll start with you, Reuben. So far, too many people are in the dark as to whether they are diabetic. And in fact, currently during this coronavirus pandemic, we understand that a lot of people are finding out about their status, their health status, after testing positive for COVID-19. And this is around diabetes. Let's talk about you, and particularly with the type of diabetes that you have, which is, I believe, type
2 diabetes.
Type 2. So when did you discover that you are diabetic, and what exactly is type 2 diabetes?
Yeah, my name is Reuben Magoko, as you had said. I am the national chairman of Kenya Defeat Diabetes Association. This is an association which was started by the people living with diabetes and hypertension with a mandate of creating diabetes awareness in Kenya. The reason why we started this organization is that in healthcare, there is what we call, should I call it, racist and a lot of discrimination. So that creates fear. So when you go to a hospital, and this is everywhere, it's not only in Kenya. When you go to the hospital and you are declared that you are diabetic or any other non-communicable diseases, then it seems as if there is panic. Mm-hmm. You get into panic and denial. And for that reason, so many people fear to go to be tested for diagnostic testing. They fear. The other thing is that even those who are in the hospitals, they fear each other. And this is why we came up with this organization, so that we can bring people together. So because my problem started in the year 1982, when I had an eye problems. So I went to the hospital, and the doctors were asking me whether I have diabetes. Instead of testing me, they were asking me. I didn't know anything about diabetes. I stayed for about 5 years, and then I started having boils in my mouth. Mm-hmm. So just a neighboring, I come from Nyeri, and there's within my neighborhood, there's a dispensary called Wediga Dispensary. So I went there because I had boils in my mouth, and the nurse there asked me whether I've been tested for diabetes. So my mind reflected back to 1982. So I had to go to the nearest clinic, because by that time government dispensaries, including health centers, were not testing for diabetes. So I had to go. I went to a clinic in my town, and I was told by the doctor that now you have diabetes. I didn't know anything about diabetes.
Yes, and you know, just the clarification that I was seeking there of type 1 and type 2, you are a type 2 diabetic.
Yes, I'm type 2 diabetes. Mm-hmm. Yes, so
which essentially means, very briefly, what does that mean?
This diabetes that comes because of changing life. You see, there is diabetic type 1, and it's going to talk about it. There is diabetic type 2, which actually is in the old generation. People above 40 years of age and above. Yes.
Okay, and I'll get back to you with more on that. Thanks for sharing that. And to you now, Newton, you are a type 1 diabetic, a fairly young man. When did you discover, when did the doctors find out that you're diabetic? And indeed, what is a type 1 diabetic?
Yeah, so basically my name is Newton Ngugi. I've been living with type 1 diabetes for 6 years, and I'm still counting. So also I am also the KDDA Acting Secretary General. So at the end of the day, as a type 1 diabetic, this is whereby I was diagnosed in a very, very unfamiliar stage in my life. I was basically first year in campus, so it was a condition whereby it was shocked me. It came with the same symptoms of type 1, and all the diabetes have the same symptoms. So when I was in campus, that is when I was diagnosed. I went into a state of shock, frustration, devastation. What followed was denial, because it's a condition which you do not know the reason and all that. It is still unknown the cause. But basically type 1 is whereby your autoimmune system, your white blood cells, they attack your insulin producing cells. In this case, insulin is the hormone that facilitates the uptake of glucose. So that is when I was diagnosed with it, and then now I became a person who is living with diabetes ever since then. Yes. Thanks
for sharing that. I'll come back to you, Ruben. Now that the world is going to be marking World Diabetes Day tomorrow, and I'm very pleased that you've talked about the shock for a lot of people when they're diagnosed. In terms of early detection, prevention, and even treatment of diabetes, having walked this journey since 1982 for you, which is when you started feeling unwell, ahead of tomorrow, and just going back to the fact that a lot of people are now starting to find out that they are diabetic, those that have tested positive for COVID-19, some of them, in terms of early detection, prevention, and treatment of diabetes, just tying this around the fact that we're living in the times of this pandemic, what would you like to say around these issues in terms of prevention, early diagnosis, and treatment?
One thing I would like to say is that one thing I know about diabetes is a condition that need a lot of discipline and personal commitment as far as management is concerned. And also the problem that is there in this country is that the health system of this country does not have it is very much inclined on the side of curative. And this is why you find anybody talking about medicine all the time. The other thing is that the rights and responsibilities of people living with diabetes are not adhered to as far as World Health Organizations and other United Nations charters are propagating for. So the problem is that people fear to go to be tested because of the cost of treatment. But soon, let me say the problem per se is not diabetes. The problem is poor control of the sugar. So once you are told that you have diabetes, your problem actually ends from there. Because you need to take care now of managing the levels of your sugars, because diabetes is a disease of numbers.
And so you have managed your sugars for how long now? How many years has it been?
More than 30 years. More than 30 years I've been managing it. And the reason why we came up with this organization is actually to educate people. Because what people need, I've talked about people's rights and responsibilities. People with diabetes, they need care. You know, when I say care, early diagnostic is very, very important for detecting diabetes. 2, information. There is a very huge gap of information, because I said we don't care about prevention, we care about curing diseases. So this is, if we can concentrate or increase prevention in our healthy system, this disease can be, is actually enjoyable to live in it.
It can be managed.
It is one of the simplest diseases to manage.
And to you, Newton, as well, as a type 1 diabetic, fairly young man, I mean, we're looking at 2 totally different situations here. Ruben, of course, being older than you are. For you, for people that are watching you, fairly young men and women who might have been diagnosed with diabetes, in terms of managing this disease, non-communicable disease, what lessons have you learned along the way?
One of the important lessons, it's a good question, one of the important lessons I've learned as a young man is that at the end of the day, everybody has got blood sugars in their system, whether you are diabetic or not. If you have no blood sugars, you cannot exist. Everybody has got high blood pressure in their system. It is, when it goes high or when it goes low, it deviates from the norm. That is when you are diagnosed with high blood sugars or you are diagnosed with high blood pressure. The same goes for weight management. All of these things is about management. So at the end of the day, we'd like to invest in what people call about awareness. As you realize, as a diabetic, as a person who has lived with the condition, we as human beings are very adaptable to changes in our environment. In the context of COVID-19, much has happened, but we're still able to survive, we're still able to thrive. So at the end of the day, you realize that as a person who is living with any other condition, any other, be it cancer, be it cardiovascular, be it high blood pressure, be it what, you will be able to manage, because you never know how strong you are until being strong is the only choice you have. Yeah, that is basically it.
And in terms of what we've talked about today, remember tomorrow is World Diabetes Day, and therefore you're encouraged by Ruben and Newton here to go out and get tested. And indeed, their organization has more information to offer and support as well. Of course, just remembering and just reminding you that this is the Kenya Defeat Diabetes Association. Gentlemen, I thank you for sparing time to come to be with us in studio. I've been talking to Ruben Magoko. He is the chairperson, the Kenya Defeat Diabetes Association. And I've also been talking to Newton Muthaba, who is also with the Kenya Defeat Diabetes Association. Thanks for watching. Have a lovely evening. I'm Lillian Muli. Good night.